Highly contagious bugs are spreading in Vermont. Catherine Huntley learns how to keep yourself safe from the diseases and what you should do if you get sick.
We all know that familiar scratchy throat or runny nose, a harbinger of a respiratory illness like COVID, RSV, or flu. While cases are rising, experts say we're only seeing about half the COVID cases we saw at this time last year.
And it's really the same story with flu and RSV, the other respiratory illnesses that we're able to track the way we're able to track COVID-19. We're seeing increases in this, in both of these, but we're still at a relatively low level of activity.
The Vermont Department of Health says vaccine uptake numbers are also lower this year for flu and COVID.
Even though it's not 100% going to protect people against getting COVID or flu, it's going to make them less likely to get COVID or flu, and it's going to make them less sick when they have it, which means they're going to have less of a chance to spread it to others.
The highly contagious norovirus is also on the rise across our region. If you catch it, doctors say to expect around 1 to 3 days of vomiting and diarrhea.
As long as you're safe and you don't need medical care, then the best thing to do is to stay home and stay hydrated and take measures not to spread the virus.
Although some people should seek emergency care if they are having trouble taking care of themselves.
For little kids and for elderly people, immunocompromised people who are having a hard time weathering the norovirus storm, so much so that it's hard to get enough fluid in, or they're not able to eat and drink for days, or they can't take important medicines, then it's reasonable to try to seek medical care.
Though norovirus can infect people easily, Leahy says hand washing with soap and water is a great way to stop it.
Norovirus is really easy to spread, typically by not washing hands. But if you wash your hands and clean down bathroom surfaces and don't share food or bathroom spaces with others, you can stop the transmission of norovirus.
Reporting in Burlington, Catherine Huntley, Channel 3 News.